Hello everyone. Today we will be talking about a topic in which I don't have much expertise, so that's why I have Dr. Kamil Khan today with us, and we will be talking about IMGs, International Medical Graduates. So welcome Kamil to the show, and today we will be discussing, especially for Pakistani students, about their decision of studying abroad and specializing abroad after their graduation in medicine. So first of all, welcome. How are you?
Well, thank you for having me. I've been following your YouTube channel. For everyone who doesn't know, Faizan is also my brother-in-law. But we'll be keeping it professional for the duration of this interview. And obviously, I've been following your YouTube channel for quite a while, and congratulations on all the success and improvement that you've had over the course of time. Yes, international medical graduates or IMGs. It's obviously a topic that is relevant to me, so I'll be happy to answer any questions for everyone out there who might need it. Because I remember when I was starting off, I was searching for or looking for someone who could guide me in the right direction.
Exactly.
So I'll be happy to help out anyone.
Yeah, so the basic purpose of such videos is that the students who are in their third or fourth year, they might be looking for their future. And as you know, a lot of students are preparing for US MLE, UKMLA, AMC, and all those tests for their postgraduate. So first of all, before we start going into these tests, I would like to know more about your background so that our viewers can know a little more about you, like from where you did your medicine MBBS, and then later on you came here in England. So a quick summary would be helpful.
Right. So I started my medical, or like in Pakistan it's MBBS. So I started that in 2013 in Rawalpindi. It's called Foundation University Medical College. Fun fact about that: the medical college is in Islamabad, but the hospital itself is in Rawalpindi, even though it's in the same location for some reason. Anyway, so I started that in 2013. I graduated in 2017. I did my house job in 2019 because I took a year off to study for my USMLE, which we'll probably get into a bit later.
Yeah.
So 2019 I did my house job. 2020, right before COVID hit, I finished my house job, and then subsequently started my PLAB journey, which started around about April was IELTS, October was PLAB 1, and then after a year and a half was PLAB 2, and then a few other exams along the way.
All right, so we will go in all those exams, but
Yeah.
first of all, I would like to know about your decision of choosing UK over US. So if you can share your personal preference, and generally if you can share a little more about what are the pros and cons of both the programs, and then further on we will talk in detail about each of them.
Right. So just a brief overview. So as a medical student in Pakistan, you have multiple options as to what to do after graduation. So you can, the easiest, or not the easiest one actually, the most basic one is just to stay in Pakistan, and you can, because Pakistan has its own specialization program called the FCPS, or the Fellow of College and Physicians. So basically, you can do FCPS, which is training in itself. If you would like to train abroad, so then you have, every country has its own exam. So if you want to train in the UK, you will probably need to give PLAB, and then subsequent exams for training purposes. The USMLE for the US, AMC for Australia. Other countries do have their own, but they're a bit more difficult and a bit, well, I haven't much research into them. I chose USMLE first because at that point I felt that because I was in my second or third year, I felt that I would do better off in the US because Obviously, the career path is more, well, in terms of learning opportunities, it's more in the US. In terms of advancement in the medical field, it's more US based as opposed to the UK. It's also harder to get into, which is not a pro, but it's still harder to get into the US program than the UK.
Yep.
I tried. I gave, and for the US, basically the overview is, everyone knows this. It's step 1, step 2, and step. They call it steps.
Yep.
So step 1 is clinical. Step 2 is divided again into 2 parts, which is clinical and assessment based or scenario based, and then there's step 3, which is you can do it later on. And they all usually you need a very high score in across the board to get matched into a university. Now the matching process is a completely different ball game, which would require a completely different video because it has a lot of technicalities in it. I tried for step 1. I unfortunately did not get the marks that I wanted. I could continue on with step 2 and step to make it up, but I felt that I would not be able to get to that level that I wanted.
Yep.
And obviously it is financially taxing as well, because it costs a lot as well. So yeah, I just kind of cut my losses there and shifted everything towards the UK then.
All right.
Yeah.
So before you tell us more about UK MLE, which is earlier called PLAB, and from this year it's called UK MLE. So can you share what's the change and like the major difference, and along with it, can you also share the process, like the one you explained for US? So can you share that as well?
Well, the biggest change between PLAB and UKMLA is, well, the name. Well, basically, again, I gave my PLAB a few years ago, and I haven't been keeping up with the changes between the two. But from what I can gather is that mostly it is something to do with kind of coming up with one exam for everyone, be it UK graduates or international graduates. They're all in the same boat. So that would be what I feel the major, the logic behind the exam itself. In terms of preparation and the exam format itself, it doesn't seem much different. It'll be the same for us, as in for international medical graduates, it'll be the same process more or less. Maybe like 5-10% here and there. Obviously, new questions, new format, new scenarios.
Yep.
But that's still going to be the case in terms of PLAB 2 as well. The second question you asked was the process.
Yeah, like the two phases.
Right. So I'll start off with PLAB. So the PLAB consists of 2 parts. It's PLAB 1 and PLAB 2.
Yep.
PLAB 1 is theory based. It's a multiple choice question. It's just a pass fail. Both exams are just pass and fail.
Yep.
No scoring required, no percentage required, nothing. It's just a pass fail exam. PLAB 1 can be taken anywhere in the world. Like they have centers all across the world. I gave mine in Pakistan, but there are like centers in Dubai, Nigeria.
That's
US.
for PLAB 1, right?
PLAB 1, yes. The centers everywhere. And seats are there most of the year as well. That's why they have a large number. PLAB 2, on the other hand, is only scheduled or taken in Manchester.
Okay.
Because it is a face-to-face exam, or an OSCE, observed skills exam, in which there are real-life actors who are sitting in front of you, and they're acting to be patients, and you have to diagnose them, treat them, interact with them, and there's an examiner in the room as well. There are 18 or 16 stations, one of the two, and you need to pass 12.
Okay.
So there's quite a big margin, but again, every station is, a certain number of minutes long, and it can get a bit tricky. That, again, it's taken every single day of the year in Manchester, but to secure a seat, obviously there's like this huge number of people applying for it, so the seats become limited. Usually people take, I personally took academies. There are academies in London, they're very good. In Manchester, there are 2-3 different academies there as well. Obviously that's going to change a bit in terms of curriculum with the UKMLA coming in and everything, so that might change. So that's basically it. before you give the PLAB, you also need to give IELTS, and you need a certain number in IELTS. And it's not just a pass-fail. For other
What's the lower band for this exam?
So for IELTS itself, you need a 7 in each.
Okay.
So reading, listening, writing, speaking, you need 7 in each minimum,
Mm-hmm.
with an overall band of 7.5. That means you can't get a 7.5 if you just get 7s in each. You need to get slightly higher.
Yeah.
In
one of
bands.
them. Yep.
In slight, yeah. So that is a must. So it's not just PLAB 1, 2, it's also IELTS, because without IELTS you can't give PLAB 1, without PLAB 1 you can't give PLAB 2.
Mm-hmm.
So, and without PLAB 2 you can't get a GMC.
And after securing, like, passing both PLAB 1 and 2, what's the next challenge for IMGs? Like, how long does it take to be, like, to get accepted in a hospital? So how's that process, since you have been through the same situation? Yeah. So what's that like process like?
The number one lie that I was told, that after you do your PLAB 1 and 2, you'll get a job within 6 months. That was the case before COVID.
Yeah. Usually.
After COVID, I say after COVID because it's like, that turning point and everything. After COVID, jobs have become harder and harder to get into. It's not about there being no jobs. There are a lot of jobs. It's just that the competition has skyrocketed. Honestly speaking, people used to take PLAB as a joke.
Yeah.
I personally didn't go for PLAB first, and I chose USMLE because I also thought that PLAB was a joke, because everyone back then thought PLAB was a joke, because everyone used to pass PLAB and everyone used to get jobs in the UK. So I was like, let's go for something more challenging, but it's not the case anymore. PLAB is generally becoming harder and harder as the years go by, and the competition is getting, I wouldn't even say doubling per year, it's tripling or quadrupling per year for PLAB, because everyone gets a GMC registration.
Yep.
But GMC registration only makes you eligible for a job, it doesn't guarantee you a job. That is the first hurdle. Now you've gotten eligibility, find yourself a job. That is what the bottleneck is.
Okay, and to understand it better, I just have a confusion. So earlier, after doing PLAB 2, you enter the job market for UK.
Yeah.
But after the local and international graduates can appear in the exam together.
Yeah.
So does this change the job market? Like, is it more competitive in your opinion, or it's the same when it comes to finding a job?
Well, see, the UKMLA and PLAB, now both exams they will give you a GMC registration. You're not competing with someone, like for example, if you're giving PLAB 2,
yep,
or you're giving your steps, or PLAB, I'm giving my PLAB exam. I'm not competing with you, that who's going to get a GMC registration first.
Yeah.
Right? After passing PLAB, we'll both be GMC registered. But GMC registered doesn't mean anything professionally. Mm-hmm. Right? It doesn't change anything for you. In the job market, now, when I was applying, I applied for a little over a year. And I applied to different, I had no preference, be it England, Scotland, Ireland, Northern Ireland actually, or
Wales.
No, Northern Ireland, the other Ireland. I didn't have a preference. Anywhere I could get a job, I would apply. But the first hurdle was, and I got some job offers, they give you feedback on your application, what you're lacking and what you're not. So the first one was that due to the high number of applicants this year, we are limiting our applications to people who are already present in the UK.
Oh, okay.
So that was my first rejection there. You need to be in the UK. But there were obviously like a certain group they were just relying on that. Mm-hmm. Another thing, which will tie into the requirements or what people need to focus on when they're applying for jobs in the UK or even US, wherever, is, look, competition is going to be higher anywhere you go, so you need to kind of equip yourself in the same way.
Yep.
It's not just grades anymore. I'm sure, like for university, you would know this as well as I do, that it's not just grades. Everyone gets, straight A's. People get like 18 A's now, 20 A's now. Yeah, but in the long term, it doesn't matter. Yeah. Because it's not just grades. You'll get that particular percentage for grades, but everything else matters. So that was my first bottleneck. Second was I didn't do any research, medical research,
Yeah.
because we were not pushed during. We had that one compulsory research that we do in fourth year, but nothing that pushed us to go above and beyond and do our
So,
conduct
like,
our own
for
research.
example, if some medical student is studying in their third or fourth year,
Definitely.
and if they get an opportunity to publish their medical
Yes.
research, will that affect their?
Yes, definitely.
Okay.
So when you're applying for jobs, usually it's through online portals. So most common one is Crack Jobs, and they have this entire template for when you're applying. They don't ask you for your CV. You can upload your CV, but they have their own template. So they'll ask you for the first page is just name, date of birth, etc., etc., medical qualification. That is it. They only ask for one line. Where did you graduate from? That is it. Everything else is what you've done after graduating. Have you done any research? Have you done audits? Have you written papers? Have you gotten any distinctions? Have you received any awards? What extracurricular activities do you do in the medical field, for example?
Okay.
And for me, it was nil, 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 nil. So that is where I felt that, that was my first real, deer in headlight situation, in which I was like, oh, what do I do now? Because I don't have any of these, and I can't do all this now. I'm just stuck with it.
Yeah, true.
So I would definitely recommend someone who's in their second year, third year, even fourth year, just do, even if you're not doing them, just do courses in terms of introduction to research, ABCs of research, ABCs of
And this
auditing.
also applies for USMLE, right?
Yes, doubly more for the US, because the UK is still lenient in terms of intake. US will definitely want you to do other things. Well, the US already has other things set out, it's not just exams. Step 1, step 2, step 3. There are clinical electives in which students go to the US, observerships where they not work, but they shadow doctors in the US in the hospitals, and that's a requirement. It's very unlikely that you will get matched without doing those things, or even get an elective before.
And I have another question. In Pakistan right now, are there any, colleges, medical colleges, which are providing preparations for these exams during their MBBS, like preparation for OSCE or for PLAB 1 or 2? Is it built in their curriculum, or students have to go to academies?
So again, I graduated in 2017, so it's been a while. But back then, and it's still the case, I can think of a few universities whose curriculum was designed or revolved around a certain country's end goal, or it was emulating a certain health standard. For example, Aga Khan, Shifa. Those are the two the main ones in private sector. In the government sector, obviously you have King Edward, you have all these who have a very high teaching standard, and they have a very high educational standard as well. So they don't need to emulate or shadow or have this particular goal in mind that we're teaching or we're training our students to go for the USMLE or the PLAB. For Aga Khan, it was known that the students, obviously they've already been trained to a very high degree in terms of learning outcomes, but the students were successful in matching in the US, and the good thing about them was that once they matched, they were able to reciprocate all that or impart all that knowledge back into the future batches as well. So that also plays another factor as well. What they've learned from them to be put back, and then that is adopted again into their curriculum as well. So yes, Aga Khan, Shifa, King Edward, these are the universities I can think of. In terms of academies who are teaching, I don't think that there are really any reputable ones that are teaching their students privately to prepare for example, the USMLE or PLAB. PLAB has its own academies, PLAB 2 especially, and they are in the UK, in Manchester. So I took one as well, but I'm not sure about them being in Pakistan or them being up to the task, I guess.
Okay, moving forward, another thing which is very important for students to plan is the finances. So after, for example, graduating, doing their house job, they have to think about the expenses required to clear these PLAB exams. So in your opinion, what are the the exact expenses as well? So what are the list of expenses they need to think of? You said you have to take some academies as well,
Yeah.
go to UK for the PLAB 2. So overall, if you think of what are the list of main expenses, which one should be mindful of while applying?
Right. Okay. So I'll PLAB is more close to me, so I'll go with that. And whatever is the same for USMLE, I'll just mention that in the middle as well. So starting off, the first step was IELTS exam. Now, obviously the IELTS rates, they keep on changing, but that was the first big expenditure in a series of big expenditures.
Yeah.
So because usually, and that is where I feel people kind of get stuck as well, because it's one of those points in which a lot of people they kind of give up because they're like, would I get the grades in IELTS? If I can't get the grades, there's no point in going further. That's kind of where they get stuck. So that is like a personality developing moment as well for them, just to rethink whether. So IELTS, again, it depends on how many attempts you do. I would suggest one, and then afterwards in the PLAB 1 and PLAB 2. PLAB 1, my time was around 40,000 rupees, and PLAB 2 was around 3 lakhs. I'm not sure, because again the price keeps on changing in terms of rupees, not pounds. And I gave IELTS for around 20,000. So 20, 40, and then big jump was 3
Yeah.
lakhs.
And now almost everything is double compared
Yeah.
to 2019.
Yeah. So for if you talk about exams, the USMLE doesn't require IELTS. It just requires step 1 and step 2. But it still has 3 exams, because step 2 is divided into step 2 CK and CS. Step 1 would be around, I would say, the same 40-ish back then. Step 2 CS was somewhere in the lakhs, and step 2 CS was somewhere in the 2-3 lakhs. So it was very expensive. Next expenditure was obviously PLAB 2 and the flight.
Yeah.
Now, and everything that comes with it. So it's the flight, accommodation, academy. Now, academy ranges between 400 to 600 pounds depending on where you take your academy, and everything else that comes with it. If, for example, you're taking your academy in London, then you'll be staying in London as well. If you're taking academy in Manchester, you're staying in Manchester. And then there are accommodations everywhere. There are some even designed for PLAB 2 students, because they know that they're coming, so they have these apartments. So again, it depends on how many days you're staying. 10 days is
So
round
roughly
about.
speaking, all of this will be like 1 million rupees, 10 lakhs for everything during these 1 to 2 years.
I would definitely say a bit more, and this is just for PLAB.
Yeah.
USMLE would be much more, because traveling is much more, exams are more, and they're more expensive as well.
Mhm.
So yeah. Then after PLAB 2, you're not done. You're still paying money.
Yeah.
You'll have to pay for your degree. So for your registration, you will still need to pay for the license itself.
Okay.
So you're paying for the license, and then you're paying every year for the license. So it's just a 1-year license, and you keep on repeating it. Even if you get a job.
And how long will that be? The renewing of license?
Till you're working.
Okay.
Because they keep on renewing just to see that you're still working and where you're working. They keep on renewing it. So it's a 1-year license. Every year you renew it. After like a few years, it kind of like comes down. But yeah, generally it's that way. I think that would be all the expenses then.
And moving towards the end of this video, one common thing which students experience is the confusion between which exam to take, and as you said, there are pros and cons, but it's still a very tough decision, because if we see in the monetary benefits, US MLE is more attractive, but it's obviously more challenging as well. So how do you see the factors which students need to consider while choosing, like apart from the expenses and the difficulty, but like work-life balance and overall the monetary return, like overall if someone is seeing their priorities, so what should be some factors they should keep in mind
Right.
for them to make the decision?
So, I believe the first thing that you need to figure out is the first question is, do you see yourself in Pakistan or not? I'm not saying that for anything else. It's because for a lot of people, that's the first question. I don't want to leave Pakistan, or because obviously family is here, your entire life is here, whatever, or you don't see yourself out abroad. Now, if you've answered that question and said, I see myself in Pakistan, fine, done. FCP as it is. Not saying it's a bad option, it's a very good option, right? Because all three as in any postgraduate exam you take, it is an exam itself.
Yeah.
I'm not going to belittle one exam to favor the other. They're all hard exams and they're all reputable examinations. You'll succeed in any country if you give it your best. So yeah, that's the first question. Pakistan or not?
Yep.
If you say, okay, I can see myself in Pakistan, but I would want to, get an exposure living abroad as well. Then that's question number 2. Question number 2 is, what are your priorities? Again, when you're starting off, for the first, I think, a few years, you'll probably be at the same pay scale anywhere. I remember a friend of mine was starting as a junior doctor in the US, training actually. His starting pay was around that time £2,000 take home. $2,000 take home. Over here, or even $2,000, $2,500, $3,000 take home. Over here, it is again to around $3,000 take home. Comparable.
Yeah.
Okay, you won't see a big difference. Like for example, when you say like, oh, the US has a lot of benefits in terms of money, you won't see that initially.
Yeah.
So the first 4 or 5 years, you're going to struggle anywhere, or be kind of restrained financially anywhere you go. It's only afterwards that you have more opportunities. Obviously, America is huge, so they have like more opportunities there. But it comes at a cost. Generally, the US work-life balance is tough. It weighs on you not only if you're single, but especially if you're married. It kind of weighs on you because you have less time for like family and or yourself, right? You're working many more hours as compared to the UK.
Yeah.
Where in the UK you have a set limit. Legally, minimum hours are set. I think it's 40 hours a week, which is set, right?
Along with some holidays.
Yeah. The one thing that people here value more than, or put more importance in than work is taking time off from work.
Yeah.
Like their annual leave is doubly more important than working. And they work hard. It's not like they slack off, but they put equal emphasis. In the US, I've seen that it's generally more emphasis on work rather than time off from work. And I felt that the work-life balance here, it is still tough, but it's I would feel much more comfortable living in the UK rather than living in the US, mainly for the work-life balance. That's not the cause. Do you see yourself struggling or working harder? So it's not about are you capable, but do you want to? Do you want to work, hard or more? I personally am a bit laid back. I would want to, work, but then have time to myself. So I would rather go with the UK route instead.
All right. So
Sacrificing,
yeah. For this introductory video on IMGs, that's all for today. And if you guys have more questions, you can comment below, and maybe I can come up with a follow-up video in future after a couple of months, and then we can talk about some more specific topics. So for now, thank you, Kamil, for all your knowledge and time. So thank you for watching, and if you like the video, don't forget to like and subscribe. So goodbye.